want to talk today a little bit about hormone replacement therapy, the word menopause or declining output from the ovaries, and the implications that these things have for women. It is important to know that around age 40, women do start having some gradual decline in the output from their ovaries, and this decline continues until they're 60 or maybe 65 or maybe 70, with the point being is a long period of time from here to not very much. Some will drop suddenly and trail off, others much later. Either case or any case, at some point, women do drop through a threshold, and most of them will have some complaints of declining output, with the most common two things, the hot flash, night sweat thing. But they can have mood, depressed, can't think, can't remember, can't come up with a word, a name, or number, brain fog, cloudy thinking, can't sleep, go to sleep, can't go back to sleep, hair, skin, vaginal, sexual, fatigue, weight gain, honestly, 25 different complaints, and no one has all 25 things, but one thing or two things, with the most common thing, the hot flash night sweat thing. So if a hypothetical woman were to say, yeah, like, so I'm in this age group, and a few months ago or 6 months ago or a period of time ago, I was at work. Unpleasant hot sensation quickly subsided, woke up at night. What's sweaty? It's a pretty good bet she's dropped through the threshold, and therefore it's also a pretty good bet, were you to give her the bioidentical supplement and restore, that would all go away. And if at the same time she says, yeah, like hot flash there, but right about the same time, my mood and my depressed and can't think and come up with names, words, and numbers, and fog brain and cloudy thinking and vaginal and sexual, it all start about the same time. Pretty good bet that if you get her restored, it will all go away. Not always, in the sense that men have insomnia. You can't blame everything on the ovaries, but a lot of it you can. You may have heard women say, look, I'm having some of these problems. Maybe I should go in and get my hormones checked. Well, I'm not really against getting hormones checked, but the problem with that statement is there is a very wide range of normal for all these things, let's say from 20 to 80. And if someone's in the sub-basement, but she's not having any problems, she may not need anything. If she's right in the middle of the normal range and she says, oh, brother, I'm suffering, what am I going to do? It's a pretty good bet she needs to be higher. So let me just talk to you about the different hormones that we're talking about. There are three outputs from the ovary: the estrogen, the progesterone, and the testosterone. So the estrogen output, the estrogen component from the ovaries, affects the hot flash night sweat thing, of course. Most people know this. But also the cognition thing, coming up with names, words, numbers, fog brain. It affects mood in the sense of, I'm pretty together. I don't have any excessive anxiety. Whatever anxiety or mood I have is just appropriate. I feel very much in control. That version of mood. Also skin, hair, vaginal dryness, and a few other things. That is the estrogen component. The progesterone component seems to help with sleep. That's why we will give it at night. And the testosterone component, which is one of the outputs, definitely affects sexual interest, libido, but also energy, get up and go, mood in the sense of, yes, I'm excited about my life, everything's great, tomorrow's going to be a good day, that type of mood, and muscle mass. As far as testosterone goes, the problem there is trying to figure out, well, yeah, but muscle mass, how am I supposed to know this? So, and that may be true of the other things, but it's not true of the sexual. So if a woman says, yeah, but the libido thing is sub-basement, that's easy for her to know, and probably an indicator to take the testosterone supplement. So again, a lot of this is based on symptomatology. If a woman is having certain symptoms, those symptoms need to be treated. Just obviously the hot flash thing, maybe the sleep thing, but the cognition thing is important. Let me just take a minute. You hear women say this word brain fog. when is the last time you heard a man use that phrase or have trouble coming up with names and words, numbers? So brain fog is English language. It means something, um, gender neutral. And it's not that men don't complain. I mean, you name it, they just don't seem to have that complaint or at least express it that way. So when a woman says, yeah, I'm having thinking problems, I mean, what in the world is wrong with me? This is something that people need to take seriously and maybe need some attention. Let me show you a few articles here on the subject. Menopause-related cognitive impairment. Hormone replacement therapy may prevent Alzheimer's disease in high-risk people. Cognitive changes in menopause. Brain effects of hormone replacement therapy on with HRT. HRT may prevent Alzheimer's disease. Alzheimer's prevalence in women prevented by hormone therapy. Dementia deemed highly preventable. Here's how hormone therapy. Hormone therapy for women up until their 80s. You read that right, 80s. Excess mortality and morbidity in women who are not taking hormone replacement therapy. Hormone therapy and dementia. Menopause-related cognitive impairment. Weight loss with anti-obesity drugs is much more effective when they're on hormone replacement therapy. The link between menopause and Alzheimer's. Hormone replacement therapy is associated with decreased loss of brain volume and decreased problems with cognitive impairment, many other things. There's just no question that women benefit psychologically, cognitively with hormone replacement therapy, and with everything else too. If their sleep is better, I mean, this is not nothing. If they're complaining of vaginal thinning or vaginal dryness, I mean, this is not nothing. And it's important if they genetically are predisposed to having that problem, they need hormone replacement therapy. There are three outputs, as I say, the estrogen, but also the testosterone. And if a woman is saying, yeah, but the libido is in the sub-basement, she needs, I mean, this is, again, not nothing, and probably should have some supplementation with that. So hormone replacement therapy, given in the right way, in the right doses, is very important. I might add that all of these things tend to be genetically determined. When a woman starts having the complaints, what their complaints are, how long the complaints last, it's genetic. Women can be and frequently are like their mothers, but the problem with that statement, I mean, genetic, right? So the problem with that statement is sometimes they can be more like their mother's mother, or maybe their dad's mother, or maybe their dad's grandma. So to say things are genetic is interesting and it's important, it's just not very helpful. So the main thing is what the symptoms of that particular woman are. So if a woman is having symptoms related to declining output from the ovaries, our suggestion is go ahead and replace it and get feeling better. All of the symptoms that I have mentioned are not age-related. I'm not denying that there are age-related problems. It's just not these types of problems. So if a woman is having cognitive problems in her 40s or 50s or even 60s, this is not a brain problem. This is really important, and it's very good news. And this is a GYN problem. Everything else, I mean, having sleep, normal sexual function, normal everything, if her problems are caused by declining output from the ovaries, restore. One word I was going to mention is this word menopause, perimenopause. The problem with that word is there's a lot of baggage associated with doctors or women being labeled doctors labeling women or women labeling themselves as menopausal or perimenopausal. It tends to be codes, and someone's, well, that's my problem, so I'm just not going to worry about it because it's just a foregone conclusion, and it's a way to avoid addressing it. And it's not a very helpful phrase anyway. The word menopause comes from meno, which is Greek for monthly, and pause, which means period. Please stop. So stop the monthly. There are a lot of girls, high school girls, college girls, who might be on Depo-Provera to control their periods or even stop their periods because of athletics at school or any number of reasons. Stopping periods, that has nothing to do with menopause for them. So the word menopause, furthermore, it's just out of date and obsolete. I would say get rid of the word from the English language, or at least stop using it in this context, and just say, look, does so-and-so have complaints that are associated with declining output from the ovaries? And if the answer to that is yes, well, what are the complaints and how do you restore the component that is causing the symptomatology? This is the mindset that needs to be taken by the healthcare profession and by the women themselves. One final note, there's really no downside to taking hormone replacement therapies, especially if women need it. It does not cause cancer. This is really, really important. In fact, women live longer and have less cancer when they're on appropriate levels and dosing of the bioidentical supplements. The reason that mythology got into medical education has to do, a long story having to do with something called the Women's Health Initiative. If you wanted to look it up, you could. It was a study that was done back in the 1990s. Ultimately, some of the data was completely misinterpreted in 2000, 2001. There were some headlines related to estrogen therapy maybe being related to cancer. All of the conclusions that said that have been completely debunked. None of it is true, and it doesn't make any sense anyway. Why would the same molecule that has been in a girl's bloodstream or a woman's bloodstream since she was a little girl and a teenager in her 20s and 30s and 40s, and now it's declining and she's having some symptoms, and you restore the identical molecule? I mean, how exactly would this cause cancer? It doesn't make any sense. It's absurd, and it has been proven to be wrong based on subsequent medical studies, hundreds of them. So it doesn't cause cancer. There's no downside to taking it. So if a woman is having symptomatology, then she needs to be on the hormone replacement therapy. She'll benefit from it a lot. She'll live longer. She'll be happier in every category. If a woman is not getting the help she needs with this from her family doctor, with an OBGYN medical practice, sometimes the nurse practitioner who has seen the patient or a PA, they just don't know this. And so I would say, you could either try to convince someone, but it's sometimes much easier to find a doctor who specializes in this and will give you the help you need. If you are interested in finding out more about this, this is what our medical practice does, exclusively perimenopausal type problem periods, hormone replacement therapy type things. So we do televisits. If you're interested in finding out more about this, go to our website, drashford.com. We post on TikTok, YouTube. You can call us 706-353-2550. We would love to help you, and you need to get answers to the questions you have and the help you need.